So my name is Dr. John Gluckman, and my co-host is Dr. David Nelson. And tonight we have the distinct pleasure of having Dr. Dwight Lundell as our guest. All right, so again, going back, Dr. Lundell is a retired thoracic and cardiac surgeon who has done over his many years of performing in the medical arts over 5,000 open heart surgeries and coronary bypass operations. He has been involved with some of the largest organizations in the country and has been recognized for those many accomplishments. In his retirement, he is an avid triathlete, which is amazing to me. And he obviously is much fitter than most of us are in his 70s. So Dr. Lundell also had a little bit of a falling out with the medical profession when he had the courage of his convictions and his knowledge to challenge the orthodoxy that heart disease was primarily due to the problem with cholesterol, and therefore the solution being the statins that sell $35 to $40 billion a year. He had the temerity to say that it was something else. I will let him tell us what that is as we start speaking to Dr. Lundell. Hello, Dr. Lundell. Please come out and say hi to the folks.
Good evening, and thank you, everyone, for joining us tonight. I really am honored to speak to everyone.
Can you speak up just a bit louder, Doctor?
Yes, I will. Thank you very much for having me on. I'm honored to.
That's great. So yeah, why don't you take a minute or two and tell us about your many amazing years in the health field, and then we'll get into the iGalen journey that you're on. So just give us a 3-minute summary of all the great things you've done.
All right. Well, thank you very much. I do appreciate that. I was lucky enough to be in the very first class of a brand new medical school at the University of Arizona. And at that point in time, there was really not very much we could do for heart surgery. And I came very close to becoming an orthopedic surgeon because the total joints had just come out, and it fascinated me to be able to relieve people of their symptoms. But then I heard about coronary bypass, and I was fascinated by the physiology and how deep we got into controlling the circulation while we had them on the heart-lung machine, and how dramatic it was to make folks better, and when there was no other option at that point in time. So I finished my general surgery training at Arizona at the new hospital, and then spent 2 years at Yale University in Connecticut to finish cardiac surgery training. I came back to Arizona and was fortunate enough to be very, very busy, one of the busiest in the state, or maybe the country. I lived through really the golden years of heart surgery when, we were doing coronary bypasses. We were saving people's lives. We were moving on. I was making a living. I was feeding the family. Everything was good. So I really didn't pay much attention to anything else except the work I was doing. I was presented with a problem, somebody with plugged up arteries, be it in their heart or in their legs or in their neck or whatever, and I had a solution. So I really didn't put much thought into it. And one day I looked down at the coronary arteries, and they were red and swollen. And those are two of the cardinal signs of inflammation. And it didn't make sense to me, the whole cholesterol story, why a substance that we make and a substance that's critical for the survival of every cell in our body, particularly brain cells, why would that be harmful? It didn't add up. And I would see patients back for another operation 8 or 10 years later, and they still had normal cholesterol. So that added to my skepticism. And then the pharmacy companies were just pushing so very, very hard for us to prescribe their drugs. And once again, I didn't buy into it, but I looked at the idea of inflammation, and then lots of other people smarter than me began to take a look at it as well. And indeed, in 1999, our most prestigious medical journal, the New England Journal of Medicine, had a feature article called Atherosclerosis is an Inflammatory Disease. And indeed, they laid out all the various biochemical and biological steps whereby the process of inflammation would allow cholesterol, even normal levels of cholesterol, to be deposited in the wall of the blood vessel. So I did a forehead slam and said, well, here I am treating a biological problem with a mechanical solution. I was a glorified plumber, if you will. And so unfortunately, mainstream medicine, yes, they agreed it was inflammatory disease, but what was the solution? The solution was to find a drug or a medicine that would reduce inflammation. We never ask the fundamental question of what's causing it, and can we change what's causing it? Right. So that led me to a lot of disappointment, and I did a lot of research and decided I knew the main cause of coronary disease, and I started trying to get the hospital to change. And I was a founding partner of the second largest heart hospital in the country, and I was chief of staff at the time, but it wasn't received very well, and I'm not the most skilled politician in the world. So anyway, we had a falling out. They didn't appreciate me trying to interfere with their huge revenue stream, and so we parted ways. I was ready for a change anyway, because, as I say, I was winning battles but losing the war, and so I hope I'm still in the healthcare field. I hope I can save more lives and make people healthier than I really could with 5,000 coronary bypass operations.
Well, that's a pretty impressive number, and having gone through 3 stents myself, I know what's involved in going beyond stenting, and so I salute you for the amazing skill that you've accomplished and shared with the world over the years. So when you got the insight that inflammation was the presenting condition of the arteries, and then you started doing some additional work, did your path cross with Dr. Yudkin's work, The Pure, White, and Deadly?
Yes, I had certainly read his work, because as I looked at the history of the so-called diet heart hypothesis, there, as heart disease in 1900, it was really rare as hen's teeth, as they say. And then by 1950, heart disease was reasonably prominent. And there was 2 schools of thought. Ansel Keys led the idea that it was saturated fat that was raising blood cholesterol, and blood cholesterol was causing the heart disease. And John Yudkin, a physician from, I think he's a physician, or scientist at least.
Nutritionist. Yeah, he's a nutritionist.
From Britain. With a doctoral degree, correct.
Sure.
At any rate, he made the argument that it was really pretty stupid to blame a new disease on an old nutrient, namely fat, something that we've been eating since the dawn of mankind. And so Yudkin made the argument and presented a very compelling case that the thing that had changed in our diet was not the level of saturated fat, but the thing that had changed in our diet was the amount of sugar we were eating. And really in 1900 we ate only a few pounds per year, but by the 50s it was up to maybe 50 pounds a year, and today we're at 120 or 180 pounds a year if you count the other processed grains. So he made a very compelling argument that it was sugar that was causing the heart disease.
How was he received?
About like me. The interesting thing is that Ansel Keys had received money from the Sugar Association as early as the 40s. And when World War II, we rationed sugar, and so that's when they really got together and started giving money to scientists to try to show it was healthy and that we should eat lots of sugar. And, of course, the cereal makers and Kellogg, and that's another story. He was a very unusual character, the inventor of Kellogg's Corn Flakes. And, in fact, Post was another person who at that point in time they thought meat was evil, and Graham, who invented the graham cracker, was another one of these people who thought that sex and the evil thoughts and whatnot came from meat, and we should eat only grains. At any rate, the rise in the amount of carbohydrates and sugars that we'd eaten really, in my mind, made a great deal of difference. Now, the one thing I'll throw out there is that at that point in time, everyone smoked cigarettes. We put them in the soldiers' packs. We gave them away free. Not one physician in the country would dare criticize smoking. And when President Eisenhower in 93 or 95, 65,
yeah.
President Eisenhower had a heart attack. They put him on Melba toast and, coffee for the rest of his life. He was miserable. He had another 3 heart attacks. Nobody dared mention the fact that he'd smoked 3 packs a day for 40 years.
Right.
But be that as it may, the main nutritional difference was our increased consumption of sugar. And you can make that case very, very eloquently. I have the book, as a matter of fact, and you've mentioned the title, which you should tell everybody.
Well, I have posted it in the Facebook groups. The title is Pure, White, and Deadly by John Yudkin, Yudkin. Amazon still has it, and you'll be able to find it there. So after that whole thing happened, when he came up with that theory in the 50s, and then, of course, Ansel Keys, as you say, was promoting the low-fat diet, then we had another couple of major events. And you were around, and you were quite active, I'm sure, at the time. But at the time that Richard Nixon was going for his second mandate in 72, we were still in the middle of the Vietnam War. But the biggest problem that he was having was the housewives were in the streets because prices of food, because of the inflationary spiral, were going out of control. So his next big thing was to try and figure out, how do I win this election? And he came up with the idea of the war on poverty. And his solution was to lower the price of food. And he appointed his Secretary of Agriculture, this guy Earl Butz, who made some critical decisions that changed the way the rest of America was to eat for the next half century. Do you know that story?
Yes. Earl Butz. So
Would
that
you
was
tell
the
us a
time
little
that
bit?
Subsidies of grain came in.
Mm-hmm. And the grain that, we went from tiny little farms to massive industrialized, mechanized farms, and they ended up producing so much corn that they had massive surpluses, even after they used them all in various ways and then fed all the cattle and everything else. And then the big thing was that the Japanese invented this process called high fructose syrup, or high fructose corn syrup, and those two things converged in the early 70s, and we ended up having this terrible product infuse every foodstuff that we now have, and that's when the massive epidemic, the increase in obesity and diabetes, took off. That's an unbelievable story that nobody seems to really want to talk about.
Yeah, that is the story. And the other thing that converged about the same time, and maybe was a result of that, the Senate Select Committee was originally founded to end hunger in America.
Right.
And George McGovern, the senator from North Dakota, was in charge of the agricultural state.
Yep.
At any rate, so we came up with the food pyramid at that point in time, and we made the dietary recommendations for all Americans, and it was fundamentally that we should eat 6 to 8 servings of grain per day. And the big lies of healthy whole grain originated then, and of course there was a lot of lobbying went on, this and that and the other, and food makers had no restrictions on advertising, and they just went crazy with the low-fat craze, and we were told to eat lots of carbohydrates. And in fact, if you Google right now, the absolute dietary requirement for carbohydrates per day, do you know what it'll come out at?
No. No.
200 grams a day to survive.
Oh my God.
Do you know what the real absolute requirement for carbohydrates is? 0.
80?
Right.
0. Okay. Wow.
the Inuits, they're not too far north of you, used to survive on
yes, of course.
no carbohydrates.
On fat, yeah, of course, fat.
And folks today can still survive because our liver will make enough carbohydrate for our brain and our red cells to survive. And, of course, they can burn other things.
Well, we know that protein
ahead,
breaks down to be used for sugar too. So even the high protein diets create some sugar for the brain and everything to work too.
Sure. It's I don't know why we've forgotten the term, but we haven't really forgotten it. We ignore it.
No.
It's called gluconeogenesis. That means we make glucose.
Right.
The liver is quite capable of making a lot of it.
So I want to move into the next phase of this, and that is, now, not all sugars are equal. So we think of sugar, but in real terms, there's many different things that carbohydrates break down into. One of them is sucrose, but there's also fructose and lactose and, galactose and all those other oses that are also sugars. They're not equal. And then we have the story of Dr. Robert Lustig, who is so strong these days about the evil of fructose. Can you tell us a little bit about that?
I can. I'm not as eloquent about it as he is, and I've seen his talk and read some more of his work. And respected a lot. He's a pediatric endocrinologist who was dealing with these little fat children and sick children.
Mm-hmm.
At any rate, we have table sugar, which is 50% glucose and 50% fructose. And we only, through our intestinal wall, we only get glucose, fructose, and maybe maltose. Everything else has to be broken down into those elements to get across the intestinal wall. And, by the way, that's one of the critical areas where Emmalin works. But at any rate, so all, you can talk about complex carbohydrates and people get all teary-eyed about it, but they get broken down very rapidly into glucose, fructose, and maltose to be absorbed across the intestinal wall. Fructose goes through a different mechanism and is processed by the liver, and as he mentioned, and as people can read, we end up with what's called non-alcoholic fatty liver disease, or NAFLD. And, in our early experience at the Veterans Hospital, we treated lots of severe alcoholics, and their livers end up being, as hard as rock and scarred and nasty looking. And if fatty liver goes along long enough, it will end up the same way.
But the interesting thing that I found in watching his information was that the fructose actually is almost it goes into the liver almost at the rate of 6 times what sucrose does. And what happens within the liver, the biochemical stuff that happens within the liver, is scary. But it's a slow process. It's not like chronic, it's not like acute inflammation, but it's the chronic inflammation that then you saw in your arteries with all those open hearts.
Right.
And that's the fact. That's where we come right back to your interest in Emulin. So people need to be able to read the labels and look for that, high fructose corn syrup, and avoid that stuff like the plague. Anything that has anything around the word fructose has to be taboo. And then now we can talk about Emulin, and how does Emulin help us to solve, heart disease, high blood pressure, diabetes, and all the other inflammatory conditions, that you have seen over the years?
Absolutely. And the answer, I'll give the answer, but we have to go back to the fundamental problem.
Okay.
Of coronary disease, of heart disease. We can talk about diabetes and obesity. They kind of fall in there, but if atherosclerosis, if heart disease is inflammatory disease, the question is, what's inflaming the artery? What's causing the injury that allows the red blood cells to be activated that then takes up the glycated and oxidized cholesterol levels? And the biggest answer is sugar. And, if I go eat 6 Hershey bars right now, I'm not going to be sick. I'm not going to throw up necessarily. I'm going to be okay. But what's it doing inside of me? And people often don't think. The upper limit of normal blood sugar is 99 milligrams per deciliter. Over 100, we're between 100 and 125, we're pre-diabetic. Over 125, we're diabetic, and a fasting blood glucose. Well, folks should stop and think about how much glucose does it take to raise me from 0 to 100, and get your pencils out. We're going to do a little quick math.
Okay.
Most of us have about 5 liters of blood. A deciliter is, 10 deciliters to a liter, so we have 50 deciliters. A gram is 1,000 milligrams, and so a teaspoon of sugar is 5 grams, so that's 5,000 milligrams, 50 deciliters, so that works out to be 1 teaspoon of sugar will raise your blood sugar from 0 to 100.
1 tablespoon, 1 teaspoon.
1 teaspoon. And
Wow.
And a regular-sized Coca-Cola
Jeez.
has 13 teaspoons. No mother who loved their children will sit them down and let them eat 13 teaspoons of sugar. And yet, the loving mother will give them orange juice and soda pop and all the rest. So although it doesn't acutely kill us, it chronically kills us. So I call all of these things chronic carbohydrate poisoning. And so when my good friend Dory, our mutual friend Dory, called me about Emulin, I was very familiar with all the elements in it. And I knew for the most part what they did, although I've learned a lot more by reading and listening to the information from Dr. Ahrens and Dr. Raj. At any rate, what Emulin does is change the way we digest, absorb, and metabolize sugars. And it begins really with the passage of the glucose, fructose, and maltose across the intestinal wall. Emulin slows that down. Emulin slows the conversion in the liver. And then, of course, the beautiful thing about the quercetin and the other elements are that they are anti-inflammatory. They're free radical scavengers and help us overcome the oxidative stress that occurs from having too much sugar. Now, it might be a time for another talk, but the fundamentals of obesity are sugar addiction and inflammation interferes with one of the very critical biofeedback mechanisms that should tell us when we should stop eating. And let's do that at a time. But for now, the key is that Emulin stops these high spikes in sugar that occur after a large or even a moderate carbohydrate. It doesn't take much. Say 1 teaspoon. 1 soda pop gives you, theoretically would take you to a blood sugar of 1,300, which would be fatal. So, that's in the absence of the hormone insulin, of course. But Emulin slows down the process of the carbohydrates getting across the intestinal wall. And to me, that's the first and most important fundamental step. So I think it's a brilliant, brilliant product. I wished I'd invented it.
Okay. I had a lady send me a question regarding an allergy to onions. Given the amount of onion or quercetin that would be in this product, would that be a contraindication for that person using this product?
I don't think so. They should try it carefully. I think the number one, it's an extract, and number two, who knows what part of the onion is
causing the allergy.
Usually it's very large molecules and not small ones. So I would say very carefully take one, and that would not be a problem.
Okay. Well, I have you on questions. I had another lady, let's see if I can find it, who was asking me about how long would it take, and if ever, would it take for bad cholesterol to be cleared out of the system if you were on Emulin on a regular basis? Could such a thing ever really happen?
Okay.
We're all laughing.
The testing, the concern about cholesterol is overrated. The testing and treatment of cholesterol levels is the biggest fraud in the history of mankind. It's unimportant. It's a very poor surrogate marker for coronary disease. And the way you get your so-called bad cholesterol, and I didn't know that this molecule had morality to be good or bad, but at any rate, I'm completely unconcerned about it. And the way you raise cholesterol levels is eat lots of carbohydrates. The way you lower cholesterol level is eat less carbohydrates and some good healthy animal fats. So I would not be concerned about so-called bad cholesterol. I would take my Emmalin, I would cut back on my carbohydrates and enjoy my life.
Now, we've had on the Facebook pages a number of recurring controversies about the M or the C, which one being more appropriate for people that had elevated blood pressure or high cholesterol or triglycerides. Obviously, you've already answered the question of cholesterol, but which product would be more appropriate, the M or the C, for people with elevated blood pressure?
Well, elevated blood pressure, isolated without any other problems, I would say the M.
That never happens, though. That never happens.
Well, everybody has, and basically high blood pressure is due to inflammation of the blood vessels. They become inflexible. They don't stretch, and that's what's make the blood pressure go up. And so the thing we need to do is take our Emulin, be it C or M, cut down on the amount of carbohydrates we eat, which Emmalin allows us to do. It helps us with the addiction problem. And then the inflammation in the arteries will go away, and your blood pressure will come back down to normal.
So you're saying that if you take either one, which component, which of the three main components would be the driver for allowing more flexibility in the arterial wall? Which of those three do you think is providing that benefit?
I don't think I would divide them up, Dr.
Okay, all right. Okay,
I would say the brilliance of this product is the combination.
The synergy.
Because we know that the sugar is causing the inflammation, and the sugar causes lots of excess free radicals which injure the cells and cause inflammation. And so when we take the Emulin, we have the chlorogenic acid, the green coffee, which helps control our blood sugar levels. And we have the other two, which are powerful free radical scavengers and help with fat and all of those kind of things. But most importantly is they all reduce inflammation. All three components lower inflammation. If we lower inflammation and lower sugar, then we're going to get better.
Can I take you back to something basic? And this is, because we've been through medical schools and various anatomy and whatever, we seem to understand both the good and the bad of inflammation. But for the average public out there, the word inflammation is very, very scary. Can you tell us about the good things? What is good about inflammation? And then, why do you need to kind of be worried about it as well? But there is a real good side to inflammation, isn't there?
Oh, absolutely. We couldn't not survive as a species without it.
Okay.
Inflammation is the response to injury. And if that injury is a bacteria that invades us or a virus or a chemical, the response of our immune system is to marshal our armies of defenders, and these defenders are by and large antibodies and white blood cells. And it's a complicated process, and we'll do a whole lesson on inflammation and one day in one of these sessions or in a separate seminar. But we can't live without it. It's the response to injury, and we have to respond. I mean, we live in a very complicated chemical environment. We live in a sea of bacteria. We have actually more bacteria inside of us than outside of us.
and even more than human cells.
And we have to, our immune system has to sort out which ones are beneficial and which ones are harmful, and respond to them. So that's acute inflammation. Now, what happens is, if we have repeated injury, then we have what's called chronic inflammation, and we never get resolution. So the 3 steps of the inflammatory system are to recognize the invader, to respond to it vigorously, and then to resolve the situation. It's just like a war. I mean, you have to clean up after the war and rebuild everything. And
right.
So if we have repeated injuries, like 3 times a day, if we send our blood sugar to 180 after our dinners, our meals, then we have chronic inflammation, and we have hypertension, and we have fatty liver, and on and on.
That never gets resolved. Unlike when you twist your ankle, it does swell beyond what's necessary, and if you use ice, compression, elevation, and all that other stuff that you're taught, then it does resolve. The inflammation finally resolves, and you have a healthy ankle. But with chronic inflammation, as you've described it, it never seems to stop. And then, like you say, every meal, every ingestion of carbohydrate sends those sharp little shards of sugar that cut and nick the endothelial level of the artery, which then brings on all the response, which then kicks the artery. So that's the part that most people can't visualize. Can you tell us the story of how the sugar itself is causing those nicks in the endothelial level, and maybe explain what that is as well, so that
Sure.
All of us are up to speed on that?
Absolutely, and actually your explanation was really pretty good. The endothelium is the lining of all of our blood vessels. It's 1 cell layer thick, and we attach lots of things to the heart. We think about emotion and this, that, and the other, but really the endothelium controls the whole circulation, and we have about 60 miles of blood vessels in us. And this single cell layer controls the flow, controls the blood clotting locally, and lots of other things. It's a long story, but it's a very, very important tissue. Now, most cells have what's called an insulin receptor. It's called a GLUT4, and that controls how much sugar goes into the cell in response to high blood sugars and in response to insulin. The endothelial cell is sort of at the mercy of blood sugar because it's right there next door to the blood, number one. And number two, it doesn't have this insulin receptor. So whatever the glucose is in the blood and the serum is what is going to be inside the endothelial cell. And this glucose then goes into the mitochondria and gets converted to energy in the form of ATP. And as a process, in the process, we produce lots of free radicals. And normally those would be neutralized. But when we overload, it's like if you had a nice little campfire and you're sitting around, up there in BC having a nice fishing camp and a campfire, and Dory comes by and dumps 5 gallons of gas on your campfire. It's not going to be pleasant. And that's exactly what happens to the mitochondrion when we overload it with sugar, and so lots of damage occurs. And it injures and ultimately ends up killing the cells. And unlike our skin, which rejuvenates every single day, the endothelial cell takes a long time to come back. And that leads to the chronic scarring and injury of the blood vessels, which causes plaque, hypertension, strokes, heart attacks, and all the rest.
So Dr. Lundell,
go ahead, Dave.
Yes,
go ahead.
So Dr. Lundell, when that injury occurs inside that artery wall, it's like a scab is forming. Is that correct? Inside the artery, like if we injured our hand or leg or something? Because
yes,
the body goes.
Absolutely. Then that would be a blood clot, and then if that blood clot breaks off and goes somewhere else, that's either a stroke or it can go down in the coronary arteries, and that would be a heart attack.
Mm-hmm. So obviously the glucose damages the endothelial layer. That sends a message to the immune system that there's an invasion or there's an injury. That sets up the inflammatory cascade. Then you get the white blood cells and eventually have the macrophages trying to clean it up. But in the meantime, the stickiness that's being created around the area causes turbulence in the artery, and that's what causes the deposition of the cholesterol over on top of itself, and that then becomes the plaquing. That's kind of the story, right?
Yeah.
It's that stickiness that results.
That ends up causing the cholesterol actually is consumed by the macrophages, which are activated by the inflammatory process. So
okay.
We always thought it built up inside the lumen, like junk in a pipe, but actually the cholesterol and the scar that you talk about builds up in the wall of the blood vessel, and then ultimately the lining over the top of that scar gets injured, and that's when a clot can form and cause a stroke or a heart attack.
Okay. Well, I think that we've covered that particular area fairly well. Another area that is of real major concern for a lot of people is the whole notion of possibly using the M as a way of losing some weight, shaping up some inches and stuff like that. Do you understand the mechanism for that in a way that you can explain to us?
Well, yes.
Because you're a specialist in weight loss, from my recollection.
Well, we've done some things. I did a product with the chlorogenic acid in it, which was very successful, as long as the same lines as Emmalin, and that's why it resonated so great with me when Dory brought it to my attention.
Sure.
Once again, obesity is caused by us eating too many carbohydrates. And we eat too many carbohydrates because we're literally addicted. And if you don't think folks are addicted, I mean, think about our own compulsive behavior to go back and get more, or head for the, I found myself 9 o'clock at night or 10 o'clock at night standing, looking in either the pantry or the refrigerator. I'm not hungry and I'm overweight, but I want something. I don't know why, but I want something to eat. And we've all experienced it, and it's carbohydrate addiction. And it's more powerful than cocaine, at least in lab animals, and maybe in people as well. So we have the addictive quality. And let's say I'm a cocaine addict, and I suddenly didn't get the same buzz from cocaine. Am I going to risk my freedom, my family, and everything else to get it if I don't get a buzz out of it anymore? The answer is no. And so what Emulin does is slow down the spike of sugar after I've had that bagel. And so the bagel becomes less satisfying. It doesn't stimulate those addiction centers in my brain as powerfully as it did if I didn't take the Emulin. So in that way, I'm getting less reward, less addictive reward from the carbohydrate, and so then I'm able to make a cognitive decision to avoid it. The other thing is that we control everything in our body in a very narrow range, as you know. Sodium, potassium, oxygen, acid, base levels, pH, in a very level. Why don't we control our fat level in a similar way? And really, we should, by a feedback mechanism that goes to our hypothalamus, which controls both our hunger and our metabolic rate. And it so happens that inflammation interferes with that feedback mechanism in the brain and tells us we're hungry, tells us we need to eat more, even though we're already overweight. And so the two pillars are addiction and inflammation. And in my opinion, we've addressed both with the Emulin product.
So from my understanding, part of the problem with the fructose story, again, is that when we ingest a lot of fructose into the liver, what also happens is that the leptin mechanism that advises the brain of our satiety level is inhibited as well. And what that means in English is that as we have more glucose in, there's a molecule there called leptin, or a hormone, that would normally tell the brain that we're saturated, we don't need to eat anymore. Well, that messaging is interrupted, and the brain doesn't know to stop you eating, so you just keep on eating. So that's the other nefarious thing that the fructose seems to do for us.
That's absolutely correct. The fructose does not stimulate the pancreas to produce insulin. And so we don't get the high insulin signaling in the brain. And the leptin, once again, the inflammatory molecule, C-reactive protein, binds with the leptin. And so the hypothalamus doesn't recognize leptin anymore.
Ah, that's what it is.
So heavy people who are overweight have high leptin levels, which normally tell the brain we don't need to eat and we need to up our metabolic rate. And so leptin gets blocked both by the high levels of fructose or in all this stuff and by the inflammatory molecule C-reactive protein.
C-reactive protein. Okay, right. Good. Now, a lot of people on the Facebook pages are also, trying to solve all kinds of medical cases that afflict so many people. Can you make some comments at all about the place of Emulin, either C or M, in that whole story? Obviously, we have to be very careful with non-medical people getting too far ahead of themselves in prescribing or in talking about treatment or cures. But can we have a bit of an understanding of what might be the benefit of Emulin in some of these more complex conditions?
Oh, absolutely. And I'm glad you brought that up. The idea that Emulin, you can't say that Emulin diagnoses or treats any disease. We cannot say that. We'll get ourselves and our company in trouble with the regulators. And I don't like talking to those kind of people.
No.
And I don't want to talk to those kind of people.
No.
So Emulin doesn't cure anything. What Emulin does is facilitate the body. The body is a miracle self-healing machine.
Okay.
And if we, number one, stop injuring it, and number two, facilitate our immune and inflammatory systems to respond to the other threats in a normal way, then we're going to be so much better off. And I think the benefits of Emulin are that it helps us, number one, with the free radical scavenging of both the grape and the quercetin, and the lowering of the injury from the glucose, that we allow our immune system to go about other business than treating trying to respond to an artificial situation.
Okay, I can hear that you're not going to go too much further in trying to elaborate on the autoimmune diseases. I won't put you in areas you're not comfortable at this point. One of the questions I had today from a gentleman in Toronto was he himself is a type 2 diabetic, and he has a prospect that's a type 2 diabetic. And because I'm not a medically trained doctor, I don't know the complications of metformin. I just know that it seems to come up with so many people. And so there was a gentleman that was on about 2,000 units or whatever they call of metformin per day, and still was wanting to get onto the Emulin. And we've heard many testimonials and anecdotal stories from some of our users already that after a period of a week, 2 or 3 weeks, they were able to actually go to their doctors, show them the pre and the post numbers on their blood glucose levels, and then get their doctors to agree to reduce their dosages of metformin and some of the other diabetic drugs. Can you talk about that for a minute?
Absolutely. Every one of our drugs has a side effect.
Sure.
There's a cost-benefit ratio, if you want to put it that way.
Mm-hmm.
And although metformin is our first line of defense, and I'm just so disgusted with my profession and how we
You're laughing, I know.
I'm laughing. It's just disgusting.
It's so sad. It's so sad to hear a doctor like you say that, and yet I know that it's true because I've been around the industry for 20-odd years, and I know how much frustration there is among your peers. Go ahead, continue.
Well, I mean, we don't even try to cure it.
Yeah.
We say it's a chronic, incurable disease. Now, that's great for revenue, but it's not so great for the patient. I mean, what if you came in and told me you had cancer? I said, well, we're not going to try to cure it. We're just going to try to manage it. You'd be outraged and you'd go see somebody else. And yet we, you know, if I'm a doctor and I'm treating a diabetic patient and the diabetic patient gets kidney failure and goes blind and has a leg amputation and a heart attack, that's normal. If I let that person with diabetes have an episode of hypoglycemia, that's malpractice. And, you know, I tried to laugh about it, but I have to laugh about it because I get so irritated otherwise, and I've gone to a rage of some kind. But at any rate, type 2 diabetes is curable. And it's curable if we stop our addiction to carbohydrates and stop eating so many, and Emmalin is such a wonderful tool to help us do that.
Okay, folks, you heard it first here.
That's right.
and then, you know, Dr. Arends is fond of calling dementia and Alzheimer's type 3 diabetes. Where do you fall on that spectrum?
I agree completely. And
tell us about that a bit.
Well, Alzheimer's, you know, we focused on, we decided cholesterol was a cause of heart disease because we looked at plaques and saw cholesterol in there. So we went into the brain of people with Alzheimer's disease and we saw beta amyloid. So we said, well, the beta amyloid is causing it. So all the attention, or virtually all the attention, has been trying to eliminate the beta amyloid, and nobody said, why is it getting there? And it's getting there. It's complicated. I'm not sure we know all the answers, to be honest with you.
Right.
But we do know that folks with type 2 diabetes and other folks with elevated sugars and high carbohydrate diets have a much higher incidence of Alzheimer's disease. And there are some plausible mechanisms why it happens, but it's disturbed glucose metabolism in the brain. And it just is. Once again, I'm not sure we know all the answers yet, but you know, the focus on the plaque is pretty dumb.
So when we have the tangles and the neurofibrils or whatever, the components of the Alzheimer's, when they do the various scans on the brain, and the challenge with Alzheimer's with most people is it's a diagnosis that happens after death, not before, because you can't go in there and look at it, right? That's the one crazy thing about it. You don't know that it's happening until it's too late for many people. So, you know, in listening to Dr. Rajan and Dr. Arends talk about this upcoming brain product that may or may not have the ability to curtail the development or slow down the development or reverse the development. Do you know more about that? Have you had some insight into that at all?
I have not had any insights into the new product, but
okay, all right.
So I'm anxiously awaiting. It's the fear of every baby boomer, and then to my age, that we'll be demented, and it's the fear of our family that will have to take care of us.
Well, I'm dealing with a 91-year-old mother who's going through that now. It's not a lot of fun, I can assure you. Now, the other product, just to kind of end up on a positive thing, the other huge thing, as a chiropractor, you know, in practice for many years, I saw nothing but aches and pains and joint breakdown and, you know, on the outside of the skin, of course, the manifestation of wrinkling and losing skin tone, muscle tone, etc. All of those being collagen-related issues. They've told us that they already have a pure sheep collagen product ready to go into the market. Do you know any more about that?
I don't. The only thing I know is what I've seen on Dr. Arends' presentation, so I've not been privy to anything new. But it's interesting, and I'm excited about it.
Well, I think you'll agree. That's the dementia and Alzheimer's is a huge market potential, as well as this other one in the area of all the aches and pains, the fibromyalgias, the chronic fatigues and skin, all those issues. So in addition to the Emulin, which covers the biggest issue of all, which is obesity, diabetes, and all the inflammation, now we're about to open up a whole other huge market for the aging baby boomer market, as well as this whole musculoskeletal area. So we're moving into some areas that people really need to get their head around the possibilities. And when they're talking to prospects, they need to also let them know that this is not a one-trick pony company. This is a company that has some very serious long-term vision about where we're moving, and we're moving ahead of the wave. We're going to be at the top, not at the bottom of the wave. We're going to be on the bleeding edge of the wave as the baby boomers come to experience all these, massive, ills. So this is an exciting part of this company that I want people to be able to convey to their prospects.
Well, I agree completely. Part of the reason I got involved.
Okay, good. Well, listen, you've been so generous with your time. Do you want to, give us a quick little summary and exhort us to greater heights of knowledge and enthusiasm in some way?
Well, just, it's really all I can say is, folks, if you take your Emulin and get your friends and loved ones to take their Emulin and control their carbohydrates, which was the one and only patented carbohydrate manager, then you're going to be able to cure more disease and save more lives than I ever did in the operating room. And if that's not exciting, and the fact that there's, in North America alone, there's 100 million people with diabetes and prediabetes who desperately need you. I mean, what more could you ask for to sell a product and have people desperately need it?
And in terms of the value proposition, whatever price you're paying, it's compared to the alternative, especially with the American medical system that is so upside down right now. What can you say to people that say it's too expensive? Are you kidding me? Compared to what?
Right. It might have been Dory who said, if you got bit by a snake and I came by and had the endovenom, are we going to argue about the price?
Right.
Having said that, I think the price is great.
Yeah. Well, listen, you've been so generous with your time. I don't know that we have any time to open up for additional questions. I bet you there are some. Do you want to try that, Dr. Dave?
Okay. We just have a few more minutes here. Let me try this.
Any quick questions out there?
I have a question.
Go ahead.
I have a question about type 2 diabetes or prediabetes. Which would be better for that, the M or the C?
Okay, can you mute everybody and the doctor will answer? Dr. Lundell, you heard the question?
Yeah, it's been very clear.
Dr.
Aarons, Dr. Raj, and everybody else have said that for pre-diabetics and diabetics, the C is what we need.
Yes,
exactly. Okay. I
agree completely with that.
Sure. Dave, you want to try one more for one more question?
They can just on star 6 and we'll see them on the board.
Okay, good. Question is star 6. Go ahead.
Anyone else?
Hi there. My name is Kathy. I'm from Vancouver Island, and one of my distributors is a doctor of Chinese medicine and acupuncturist, and one of the comments that she's been having from some of her patients is the fact that they feel fatigued that they never noticed before. And I'm wondering if you've heard anything about this and experienced anything with people that you've got using the product.
I have not, but Dr. Nelson or Dr. Gluckman could maybe answer better.
Yes. Well, one of the things, and Dr. Gluckman, you may want to chime in here, because of the addiction of the carbs and the sugars and what it does to the system endocrinologically, there's a time that body is going to come back and rebalance, and it may take time. It may take a few weeks to create a balance, but that energy that will start to return.
Well, one of the other things that always seems to come up whenever you have a symptom that you weren't expecting, whether it's a slight weight gain or a slight increase in blood sugar level, or some upset in the stomach, or some diarrhea or fatigue or whatever, usually we kind of attribute it to the detox reaction, because in almost every aspect of medicine or healing, it's never linear. You never go from point A to B and cure a problem. It's always a circuitous road. You might go from A to C and then back to A and then back to B, etc. So you have some sideways trips that you've got to undergo. And the great equalizer is persistence and time. And one of the things that we usually suggest that people will do is back up a little bit, take a slightly lower dose to start off for a week or so, and then ease back into the dosage over 2 or 3 or 4 weeks, rather than hitting it full cold turkey, the full Monty, as it were. So usually you're going to be right when you attribute it to a detox reaction, and everybody will react differently to a new regime or a new product. Would you guys concur with that?
That's awesome. Thank you.
Oh, yeah.
Yes, thanks.
Okay. All right. Any other questions, folks? *6.
Yes, I had a customer try out the Emmalin C, and he's type 2 diabetes. He only eats once a day, and he's severely overweight. And he found no results. And I was thinking it might have something to do with the fact that he's not eating right to begin with.
Dr. Lundell?
Well, yeah, that's very unusual for someone with type 2 to eat once a day. And so
it's not healthy.
That's very unusual, and so this patient is but an unusual circumstance. When I had chlorogenic acid before, the levels are high within 30 minutes of taking it, but I also have learned from Dr. Ahrens that the levels build up over time, and so he needs to readjust his eating habits, because the Emmalin is not going to straighten out that kind of unusual circumstance.
Okay. Does that answer your question?
We're out of time tonight.
Well, it is 7:30. It's a full hour. Again, folks, thank you so much for coming on the call, and thank you to Dr. Lundell for being so generous with his time, and Dave for hosting this. And we will see you next week. Next week, we may go to a different modality, which might involve some video, and so we'll let you know. We might be using something called join.me with video. So we will see you next week, same time, same station. Thanks all.
Okay.
Good night.
Thank you.
Good night, doctor.